Hey, can you hear me, Diana?
I can hear you very well.
Oh, it's so lovely to see you. Oh, hello. I'm going to just increase the volume. How are you doing? How have you been doing recently?
Very well. I'm traveling. I'm having the time of my life in New Zealand.
That's
Yeah,
fantastic. Is it so good then?
it's really nice. This lifestyle here, everything is very open for campers. So you have
Yeah,
very nice camping spots. Nature is amazing, and it's
is it?
very easy. Yeah.
Is it like you have a lot of greens out there, so it's more like very natural, right?
Yes, beautiful volcanoes, beautiful ancient forests, vegetation, beautiful birds. Then you have like hot and cold springs. You have hot river. You have hot waterfalls. You have really amazing natural hot springs because it's volcanic island.
And
So
you
you
can
have
go and
all of
just
it.
have a bath. You can just swim,
You can
right?
exactly in the wild.
Oh, that's really cool. Yeah. Such a big change actually after Dubai, because some of you might not know, but we met with Diana. We were working together in Dubai so many years ago. How long has it been for? Like when was it?
It was about 7 years ago, I think,
Uh,
7 or 8.
yeah, so it's a big difference between Dubai and New Zealand because you have desert and here you have like hot springs, water everywhere.
Exactly, except in Dubai, sometimes sea was the temperature of the hot spring,
That's true. That's
right?
true, especially
During
in
the summer,
summer.
it was so hot in
I
the sea,
remember.
it was impossible to swim.
You can get even a heat stroke from being in the sea. It happened to me once. Actually, I didn't expect it, but it's so hot. Yeah, so I wanted
Oh
to cool down
yeah,
in the sea, and it was just too hot. It didn't work.
because you cannot cool yourself down.
No, you
It is
can't.
really like jacuzzi temperature, like
Oh,
hot
it's so
spring.
nice. We used to work together in one of the practices, and I remember when Diana came back from, where did you study actually? Because you're a vet, right? First of all, you
Yeah,
finished university in Croatia. Am I right?
in Croatia, I graduated as veterinarian in Croatia, and
Yeah.
then as I was working in Dubai, then I started my university, Chi University, Florida, and
Fantastic.
they have courses all over the world. So I went for first part of the courses in China, and then second part and exam in Indonesia, West Java. So when you were in Blue Oasis, I just came back from West Java from my one of my courses,
Yeah,
and
I remember
I
that.
was so enthusiastic, needling everybody and all the animals that were there in the stationery.
I remember that, yeah. Because you have to practice. Diana even put some needles on me on one day. Just I don't remember why did you do that to relax maybe or something. And I
Did
was
you
like,
have a headache or something?
not really. No, no,
Ah, just for
just probably
relaxation.
just for health. And I was like, with all those needles sitting on the floor in a very cool and dark, it was a surgery room because it has to be dark, right? And quiet.
Yeah,
So it was
it's the best. If the environment is so calm, then I sometimes, often when I can, I play music to animals, and then I just
uh,
we have this we call it wellness time. So it is
oh,
not like
for
a regular
animals.
vet checkup. It is more, yeah,
And how long does that kind of a consultation or acupuncture last for you when you see a patient? No.
about 30 minutes. So I
Right.
have needles in them for 20 minutes.
Okay.
It is
I
maybe
remember
5 to
that
10 minutes.
I didn't know what to expect from those needles because I've never had it. It's acupuncture, right? And you put those needles and then after like 20 minutes or something, I was trying to stand up and my legs were like so soft. And I was like, what's happening to me? It's probably that all the energy, you know more about it. Obviously, you do it, right? So the
Yeah,
same, it
everything
works.
meant a little bit grounding.
So it's about grounding, right? And releasing
Yeah,
energy and stress or unblocking it.
releasing any edge. It is about moving chi through meridians. So whenever there is a blockage where energy is stagnant, doesn't want to go further away, then with needles, I release it. It is for everything. So
Uh,
for every kind of disease, I can use acupuncture.
all right, so it works in the same way in animals, right? So it's like moving that
Exactly.
energy and grounding them and releasing those blockages that helps them to heal, right?
Exactly, exactly. And there's a lot of functions of every point has different functions, so I can use it
I've heard.
for different in different ways. If there is heat in the body, I can release heat with one point. If there is redness, if there is itching, if there is
Okay.
stagnation in the liver, if there is seasonal allergy, or if there is epilepsy, there are different points I can
Wow,
use.
that's serious. Epilepsy is a very serious neurological condition. Wow. Okay, so tell me now, because it's all like sounds amazing, but how do you diagnose online then your patients? How does it work? Because coronavirus was here, so you had to adapt, I believe.
Yeah, but because first of all, I don't only do acupuncture, I do also food therapy and
Oh yeah.
supplement therapy. So I have online patients. When I see my patients online, it is very
Mhm.
important for me to see the tongue, because on the tongue I can see regions and organs, how they are, what
Even
state they are in,
really.
and I can see on the tongue you can have like the tip of the tongue is lungs, and then sides of the tongues are liver, then deep behind is kidney, the center is digestion, spleen, and stomach, like that.
And does it
Different
change the color or the shape, or it has something like split?
Exactly. It changes color
Really?
and shape. Exactly. So it can be a
Wow.
little swollen, or it can be a little bit thin and loose. The tongue overall can be more rigid, or it can be more flaccid. And then we can see the difference between yin and yang. It is very important to balance the energy. The energy has yin and yang parts. So
Yeah.
we want animals and us to be balanced with this. Yin is
Yeah.
more cold,
Yeah.
yang is more hot. So on the tongue, I can see if they feel hot or cold, and I can see if there is pathological heat or damp. If there is damp in the body, which starts from phlegm, and then if there is damp in the body, I know that I need to release it with food. I need to get some food that will take out this damp from the
Mhm.
body.
That's
If there is heat
incredible.
in the body, I know that I need to give them some cooling food to cool down the body, especially if they have skin issues. If they have hot skin, I need to give them something cooling to release all of this heat. Yesterday, I had a client, I was
Yeah.
talking to her. She's a Cocker Spaniel, is a dog.
Yeah.
She's 14 years old, and now she developed a tumor on the spleen, but her
The dog.
problems was the dog, yes.
Oh, that's a
So her
serious
problems
one.
were, it's a serious one. But
Yeah.
found out that she was constantly hot. She was hot since she was a puppy. She cannot stand the summer. She pants a lot during summer. She has bladder issues, like bladder heat. It is infection of the bladder, but we call it bladder heat in
Right.
Chinese medicine because the blood is dripping. Then
The
she
blood is
constantly had,
dripping, right?
yeah, exactly.
Like you
That's
have constant. Mhm.
whenever we see blood, we call it heat in Chinese
Oh,
medicine.
right. Okay. That's
So she was
interesting.
constantly hot, and she was eating kibbles all her life. And
Yeah.
that is adding up to the heat so much that
Okay.
they cannot really stand it anymore, and it has to go out somewhere.
I think interesting. Even recently, I had a patient, and the lady was saying the consultation was about something else, and she was saying that it's ongoing problems with the blood in the urine, actually. Yeah,
Exactly,
so it's a
because it
perfect
has to
patient
go
for you.
somewhere. The
Oh,
body wants to get rid of it. How does the body get rid of all this pathology? Through urine, through feces, through panting, right?
yeah, yeah. Ah, it's incredible. Because actually, what's happening together with Diana, we have this approach that we would like to reduce the amount of drugs that we are using. Because at the moment, what's very easy, like when you have allergies, right? Because our course is about allergies, you being given steroid cytopoint or apoquel, right? Or there is some people use hypoallergenic food. It's some sort of an option, right? But if it doesn't work, and I know that we have patients that they are really struggling with trying to reach further and trying to reduce the doses, right? So when there is a support of the Western medicine, so that's what I'm doing in here, and then actually there is this perfect component that you can provide, which is like yin yang, right? So we do a
Yeah,
little bit of medicines, but we are trying as well to find the reason why the animal is reacting and how to
exactly.
reduce it, how to help him in natural way, supportive way, through diet, through
Exactly.
supplements, right? As well.
True. Yes, it is so nice that to hear and to know people with this approach. It is not
Yeah,
there's not a lot of us there.
I know.
Whenever I talk to somebody, people tell me, "Oh, this is so rare." Whenever I talk
Yeah,
to my veterinarian, they have no idea what I want because people
yeah,
do their own research at home.
they
People are
do.
well educated. People are not
Yes,
stupid. People go
yes.
Google and they get like she got the article yesterday from my university from America. She printed the article. She bought it for $10. I don't know online about hemangiosarcoma. She had no idea that is my university. You know,
Right,
people are
imagine.
reaching out to everywhere, so they're well educated, and
Yeah.
often they come to the vet practice, and
All
what
they
do they
get is
do?
drugs.
Give them right, just
Yeah.
injections.
Yes.
Animal will get better for briefly, but then things get worse, and underneath there is a problem that was never looked up.
Yes,
There is
exactly. It was the
something
same.
happening in the root. This
Yes.
root is never sorted, right?
Yeah. Oh, it's
So I'm
fantastic.
so
It's so
happy
nice to see.
that you have this urge to change this. Maybe we are like really changing this.
Well, hopefully,
Um,
fingers crossed. We are really trying our best, but actually explaining people that they can try to find reasons and they can try to reach to the core or the bottom of the disease, or at least try, right? Is very important information because people very often, my clients, they don't even know that they have options, right? And
yeah,
I heard that so many times when I was doing online consultations that they just don't know. And that's why we have that course to open, options for people to try to do it in a different way rather than just give drugs, especially when
yeah,
they are on steroids for a long time. They have a lot of side effects, so and it's a problem. Okay,
yeah.
so I've got a few questions for you because it's a very
Yeah.
interesting subject, if that's okay. Because I know that some people struggle with cooking and why cooking is a good option. How can we do it actually, and why people are hesitant to do it, right?
Okay. Well, first of all, when you cook, you choose your own ingredients. So
Yeah,
you know that you bought meat from
for
which
sure.
source you bought meat
Yeah.
from, which source you bought vegetables from. It can be from your own garden. Often I prescribe
Fantastic.
food that is, I always prescribe seasonal food, but often I ask people, what do they have at home? So they don't have to buy everything. So if you have a Swiss
Mm,
chard at home, probably you will feed that to your dog. I will find some way to adjust everything else to what you already have. And
flexibility.
cooking for your dog, it is also giving your energy. You know, you can give love into this food. It is important. You know, it makes
Oh,
it alive. You give intention to this food. And then you
okay.
can also, for people can cook. I give them a menu for 24 hours, so they split it
Okay.
in 2 or 3 meals per day. Somebody even has 4, but then they can cook once per week and put it in the freezer. You can even freeze it up to 3 months and unfreeze it,
This
warm it
is
up a little bit.
Oh, of
Yeah,
course. This is fantastic solution as well if the dog is suffering from storage mites, because if you have it frozen, the storage mites wouldn't grow on the food because it's not like kibbles dry, exposed to the air, where storage
yeah,
mite grows and it's causing
yeah,
some allergies as well. So this is a perfect
exactly.
solution for those dogs as well. Freezing food, yeah. Okay.
Yes, you know a lot about that, right? When the grains are just
Open
full
bag.
of these mites, and people don't have no idea.
Yeah, I tell them to
You
freeze
know
the
what to
foods as
do.
well. Yeah, just even if they
Yeah.
use kibbles, right? But now we have an option with you that they can actually cook the food by themselves if they know how.
Yeah.
Okay, so tell me, how do you choose ingredients and how do you make it balance the menu?
Well, I choose ingredients according to yin and yang disbalance and the 5 element disbalance. I have to find out when I talk to people, I need to find out what is their dog's constitution. So we have 5 different elements we are working with, and I find out about that by knowing more about personality. They have to tell me how the dog is with other dogs or with people. Is it
Stress
more
levels.
vocal? So I have a bunch of questions where I find out what is the core, so I
Good
know
evening.
what is the constitution. Then about I may decide for food based on the constitution, and then on changes that happened according to constitution. So yin and yang changes, and different elements that are affected. So food is directed directly to one of the elements. So for example, if I want to treat kidneys, if the kidneys are a little bit weak or they're suffering, or animal was ill very early on, very young, then sometimes I use beans. Beans look like kidneys and they are directly going into the kidney or water element,
I've
for
heard
example.
that before. Yeah.
Yeah.
Okay.
Or if I want to treat spleen, if I want to heal digestion, which is slow, and that's why maybe allergies are also starting,
That's
then I
common.
will use sweet potato or
Oh,
pumpkin.
all right. So in England, we have
That's
a
how
lot in
we're
common as
using them.
well. So it's easy to
Exactly
buy in a
right.
shop,
It's
even
easy
if,
food. It's nothing complicated. And
okay.
then I have a program which is only for veterinarian nutritionists. It's American nutritional program
Wow.
where nutritionists are working. I put all these ingredients in, and it calculates how many of each ingredients is necessary for food to be balanced
This is
with
so
vitamins and
important.
minerals.
Yeah. Because
Yeah.
I was actually searching for a person who is skilled like you, because you're a vet, so you know everything what you should. Plus, you know that you finished that the dietitian, you have that dietitian diploma. So keeping the
Yeah.
balance is very important, because people are trying. I know that some people are trying to cook food at home, but they just simply don't know how to do it. And I just don't know how to help them, because that's not what I do. But you can.
Exactly.
Yeah, and this is
Yeah,
fantastic.
and
So
people are afraid to start cooking
they
because of
are.
that. They don't know how to
They
adjust
don't
it,
know.
and they are right. They can make problem long term. They can really make problem, and also they can really make things worse. If
Can
you
they?
give dog who is hot chicken, you will make things worse. If you give a dog who is hot lamb, you will make things worse. You need to go with cooling food, which is fish, maybe turkey, maybe neutral food, maybe pork, depends.
Depends, yeah, of course. So I know that we asked that question, but I'm not sure if I got it very well about diagnosing patients online actually. Do you speak to the people over the phone or Zoom or some photos?
Yeah, over the video call like this. It would be Zoom or WhatsApp. I always have my client's WhatsApp number, so we can always talk. We
That's
first consultation
brilliant.
is okay. Let's say WhatsApp video. It is maybe 1 hour, something like that, when I ask all these questions, and then I make meal plan. I send them meal plan, and then they can ask me whatever they want through WhatsApp in the next. Well, however we arrange the package.
All right, so that's how it works. That's fantastic actually, because it means that you have this connection. So if the dog doesn't like certain ingredient, you can replace it, right? Or if it's difficult to find, or
Exactly. Especially at the beginning, we change if it's necessary. And I need
oh,
them to send me pictures of their dog's tongue once per week, so I can
oh,
see the
right.
progress.
Okay, so it's very constant actually access to your help, right? Until the problem is solved,
Yes,
right?
they can always. Yeah, if everything is fine, I don't hear from patients maybe for weeks, but whenever they need something, they will ask me.
All right, that's
But at the
interesting.
beginning, it's important. When we start and when we adjust food, we go gradually. So I need to know how the animal is responding.
I have one related but unrelated question. Actually, it is related, because one part of our course and diet is as well. I mentioned to you before is those mushrooms, right? And I love
Us,
using mushrooms, but it's very important,
me
because you
too.
mentioned to me before, because we have a separate lesson about it, to not overdo them when you have allergies. That's what you mentioned. That's
Yes,
important as well, right? That's why you would be perfect person to actually tell which dog can have which mushroom, because they have good results, but
exactly.
you need to know how to use them, right?
If they have too much yeast, if they already have malassezia,
Yeah.
sometimes mushroom can create more damp.
Oh, right.
So I use mushrooms.
Yeah,
Yeah,
important.
I use mushrooms more when the problem is autoimmune.
Okay,
The
to stimulate
allergy,
the
we
immune
can
system.
have autoimmune.
And I have another question,
Okay.
actually about the supplements.
Yeah.
Are you using any supplements more like for the digestion? Because we know that the healthy intestines are quite important, especially in allergies. What do you do
Yes,
here?
you're
Is it
right.
special herbs or more like components or tablets? How do you do that?
It is really wide. It is there is a lot of things that we can use. Probiotics, absolutely, you're right. Probiotics I frequently use, and prebiotics.
Mm-hmm.
Then I need to use something to balance vitamins and minerals sometimes. So I have these very nice mixes that I use depending on where people live and what is available for them and what
Yeah.
will be when I make the balance plan. Then I see what might be missing, and then according to them, I can suggest what to buy. Also, Chinese herbal medicine. I frequently use Chinese herbal medicine, but that is something that people cannot buy themselves. I will have to prescribe and I will have to order for them, for
So it's
example.
prescription medicine, right?
Um, yes, these are medicine created also in my university in Florida.
All
So
right.
through the university, I can
And
have
can it be
this
sent to
medicine.
Europe and to England or elsewhere?
Yes, I
Not a
have
problem.
a distributor in Ireland,
Oh,
so he can then
okay, got it. Yeah. And
I can arrange that. And often I use omega oils,
yeah,
right? Like cod liver oil, for example. That's
okay,
great.
okay.
Um,
I've got a medical question here. You don't
then
have problems with pancreatitis with too much oil because they struggle with digestion?
yeah, it
Oh,
depends. Not everybody can have
yeah,
that. So
fair
I
enough.
have to know about digestion. That's why in consultations I will find out if there is a lot of damp, if there is a lot of if there's pain in the epigastrium. So there is also one more thing that I do with my patients. I forgot to say that
Okay,
I send a video to my clients about how to palpate the back. So they
okay,
just send me the video back.
okay. And that
There
tells you
I can
something.
see if animal reacts on some part of the spine,
And what does it
and
tell you
that will tell
actually?
me a lot. It tells me about the organs because there on the back we have back shoe points, and when you press these points, then you can feel you can see the movement or twitch in the skin. But when people go down this down the spine, it is very easy for them. They don't have to know what they're doing, but I will know when I see what they're doing,
Right,
which
okay.
points they
Because
touch.
your experience, of
It is
course.
not complicated.
That
Yeah.
do you do the same for people? Because it sounds so amazing that I could come and treat myself.
Yeah, I do
Yeah.
actually. I did a lot in New Zealand. I did people a lot, and it all started with just needling a friend, and I
Oh my
was needling
God.
her. Yeah,
Okay.
it's so cool. And then I can also guide people through breathing. I often needle my partner, for example. I also guide them through breathing, so I can direct the energy that I'm unblocking.
Wow, that
Like
sounds amazing. So you do as well helping people online as well, or you have to see them? I mean, in terms of people.
in terms of people, I just needle people. I don't do
Okay.
nutritional program for people.
Ah, no, fair enough. Yeah, that's true. Yeah, that's true.
Yeah.
Okay, lovely. So tell us actually where the Academy members can find you. Do you have an
Oh,
email
okay.
address? Yeah, or
Well,
page?
my email is peakypipats@gmail.com.
Okay, so I'm gonna
And
write it down and add on our program so they will
yeah,
find
you
you.
just put
Okay.
it in. Awesome. And they can find me on Instagram under Peaky Pipats.
Keep it. So that's the name of your company, of your brand, right?
Yes, that's my brand. Yeah.
Okay, lovely. And do you have perhaps maybe some kind of special pricing for our academy members? Fingers
Oh
crossed.
yeah, sure.
Because I'm
It's
excited.
it normally it is 100 pounds, but
Okay.
for your members, it will be for first 5 clients, 80 pounds.
Yay! Okay, guys, so you gotta just, click the button and just go to speak to Diana, right?
And
And
that
book that call.
includes the
Yeah.
call, the menu, and then for 3 months, all the adjustments in the next 3 months, and then every 3 months you would just renew the membership with 50 pounds.
Wow, that's fantastic, right? And actually, at the very end, I have one more question because I remember once you told me about one of your patients. Her name was Hope. Can you tell us the
Oh
story
yeah.
about Hope? Because I think it was a skin condition that you
Oh
treated.
yeah. Oh wow. She was
Amazing.
diagnosed. She was diagnosed with pemphigus, which is autoimmune untreatable disease. It is really
Yes.
difficult disease. It's not only skin problem.
Yeah.
She was so really feeling miserable. It is a Bichon, 10 years old Bichon,
10 years.
very lovely family. They're taking such a good care of her. She's beautiful. But she was with these skin issues. She was
Yeah.
also feeling
Symptoms.
not well in herself. She had visceral problems. She had pain in her belly, in her abdomen, all
Wow.
over the body, basically.
What about her
And
skin or eyes? Any problems like
so
visible
this
as well?
skin problems were around her mouth, around her nose, all over her chest, all over her back, red pustules. So it was inflammation with wet middle. So it looked
Pus?
also like a purulent discharge in the
Oh, yes,
middle
some
that
pus.
started to be a crust later.
Mhm.
So it was the yellow crusts and pearl discharges on top of hot spots or like round red inflamed areas in the skin.
And what's your
Also
medication?
ears.
Oh, sorry. Sorry.
So she was treated with corticosteroids high doses, and
Mm.
they made her even worse. So
That's
owners did
interesting. Mm-hmm.
Mhm. Because it can make animals worse when they have problem in the liver. In when there is liver stagnation, corticosteroids will make it worse. It looked good for 5 days, for example. It's cleared out for 5 days, and then it would come again. She was also
Interesting.
on high doses of antibiotics. That was, I think, necessary at that point because the immunity was already going so down because of corticosteroids.
I do.
Antibiotics I would not take off at in the beginning. I didn't get her of antibiotics immediately, just gradually.
Mm-hmm.
So she came. I did also acupuncture on her, but the most important part was food therapy.
Okay.
And she got after 6 months, she got completely cleared. After
What?
3 weeks, she was much better. After 3 weeks, she was already running and feeling happier. She didn't have pain in her viscera anymore. She didn't have pain in her belly. That was important because it was really this
Wow.
hypoallergenic dry food, dry hot kibbles in her hot body were making her body feeling so under pressure. So
Wow.
immediately with food, after 3 weeks, she was feeling so much better. But after 6 months, completely cleared. Now I received a message from the owners the other day that they are so grateful. They feel that their dog is completely healed. There was no signs of any skin changes in the last 1 month.
That's incredible.
Just with
So
yeah.
basically, you're actually answering my questions because you're right. In some cases, either steroids or some hypoallergenic food it works very well, but there are cases when it doesn't work. And I've been always wondering why. I always thought it's just very high sensitivity, but there is more to it because you're telling me that they might have, for example, liver issues. It not necessarily has to come out on the blood test, right? But then
Exactly.
there
That
is a
is the root
problem.
problem. That is the root problem that is screaming, help me. And nobody wants to, and everybody's just like blocking, shut up,
Yeah.
putting the tape on their mouth.
Oh, it's incredible. I'm learning with you as I go. This is amazing. So when I'll have those difficult, cases, I will give them your numbers and just go to Diana because you
Of
don't, I can't help
course.
you with the Western medicine, but then we have another part. So
And then we combine, and that's
yeah,
perfect how we can
yeah,
combine. Sometimes
that's
they need
lovely.
antibiotics, but often they need
Yes,
probiotics, stuff like that.
yes, yes, yes.
Absolutely.
Oh, that's lovely. So Hope is really happy right now and she has hope
Oh, she,
back.
yeah,
Yeah.
she is like 5 years younger, running around, fluffy, beautiful fur. Her fur became so, she looks like a dandelion, after
Right. Imagine her
blossoming.
happy dog. This is very important to know that we have options because they don't tell us at the university that that actually works and there are options. They just tell us some route that we have to follow and it is okay in majority of the cases or some cases, right? But not all of them. Plus finding the reason why those animals are reacting. Same like with people, with us, right? To reduce the the drug use, to reduce the antibiotic use too, because there is resistance of the bacteria, which is a big problem these days. Same with steroids. They have so many side effects. Why do we need to use it if we can do it in different way? We can combine both. Oh, as well, you told me that you managed to reduce the dose of the medicine that she was on slowly with the diet,
Oh
right?
yeah, very quickly. I think in 5
Fantastic.
days we completely went off antibiotics
All right.
with
What
her.
about
But
steroids?
in general, I reduce the dose of corticosteroids gradually, and then sometimes I change them with Chinese herbs.
Okay.
Just also
All right.
gradually increase the dose of Chinese herbs. Depends on how severe the case is.
Yeah.
Also, the body gets used to this medicine so much that it
Mhm.
cannot get shocked. It needs really gradual adjustment.
Yeah.
And yeah,
Okay.
and it's very important when we go with food that people don't give anything else. When they give only the food
Ah,
that I prescribed. That
that's with
is very
everything.
important because I
Yeah.
can reduce corticosteroids, but if somebody will give chicken to this
Yeah.
dog, a
Yeah.
child or a grandmother, then
It's all gone. Yeah.
we're back to basics.
Yeah, yeah, I know. It's the same with the elimination diet when the people are trying to find allergens by food, right? And they just give something. I said, don't give them anything. I even tell people sometimes to wear a muzzle if the dog is like,
Yeah,
eating everything and licking
when
poo.
they go for a walk.
Yes. I tell them,
But
wear a
sometimes
muzzle.
yeah, exactly. But often I stick with treats, herbal treats or vegetable treats, for example. So they can make like
Okay.
cookies that are allergic neutral, and they can, for example, give celery sticks or carrots, something like that. Depends who.
Okay. I've got actually one more question. When you have a new patient, do they need to do the blood test before, or that it's not necessary because your investigation that you can do in your own way, right, is
Yeah.
enough for you to get the information to start the treatment? Because you mentioned about minerals, vitamins.
Well, I always want to see the history. Whenever they have recent results, they will send me to my email.
Mhm.
And if I see something suspicious when I see the dog, then I will tell them, well, you have to go do the blood. It's something there I don't like.
Okay.
Something looks weird.
Yeah.
But most cases, I will go with therapy right away. I mean, with
Okay.
plan right
That's
away.
amazing. So imagine how
Yeah.
much you can read from the dog, even though it's as well online, right? Be from those
Yeah.
points, from seeing the tongue. Like it's not so obvious for us if we don't have that knowledge, right? Because it's new
Yeah.
as well for a lot of people. But it's so great that Chinese, we are going back to the roots because it's been used for thousands of years, that medicine,
Yeah.
right? And it had
Yeah.
amazing results. And we are slowly getting back there again, which is fantastic because it can bring a lot of benefits. It's how the nature created us, right? So
Mhm.
it's healthy, but you need to know how. That's important. Hence we have you. Okay, thank you so much, Diana, for this interview. It was so lovely to see you. So many informations as well for me as a vet, because I'm learning as I go, and hopefully, our academy members will just keep calling you, and you'll have a lot of people, because there is a demand and there is a need for that kind of approach. Big one. And finding somebody who's so skilled like you, I was searching for quite a while, is very difficult, right? Because you're a vet and you're a dietitian, so you know what you're doing from medical point of view, plus there is this addition, right? So we can
Yeah.
always cooperate with
Exactly.
Western medicine if I need to prescribe anything, or the vets here, right? And you can
Yeah.
do from your own Eastern point of view, which is great.
Exactly.
It's like yin
Mhm.
yang. It's gonna work.
Yeah. 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 Thank you so much, Dr. Justy, for your interest. It is really so. I'm so happy to know that my dear colleagues that are my age, this group of people, that we are
Girl.
changing the perspective and we're
Yeah,
changing the approach. It is
yeah,
very important
yeah,
to go back to holistic, to
yeah,
see the body as a whole, and
yeah,
not going directly into the molecule that changes, that needs to be changed, that needs to be fixed.
yeah,
Nothing, you cannot fix anything from that, changing the valve there. You
yeah,
have
yeah.
to see the body as a whole. You have to see where the environment also of the animal. You have to understand the also the relationship with their owners. This is also something that I check. I learn about their emotions, and I
Right.
learn about people's emotions, owners' emotions, and how they combine when I talk to them. This is also very important.
Yeah, it is. I've started seeing it recently, actually, the relationship, how the owner is, and that has actually strong impact on the dog as well, right? I,
Exactly.
I've seen that recently, started paying attention to it actually, because I know that it's important in people how we feel, so it must be as well in animals, which you just said that it is. So yeah.
Mhm.
Lovely. So enjoy. Is it morning now in New Zealand? It is, right?
Yeah,
Yeah.
yeah. It's early in the morning, and my day is just starting. I have some meal plans to do.
Right.
I have, for example, my old patients also
Yeah.
to Jack Russell and Maltese. I'm treating them now for a year only with food therapy, and they're really doing so good. One was the pancreatic
Wow.
patient, completely resolved, and the
Yeah.
other one was also skin patient. But now we only see the root, which is liver. Well, that's a little bit maybe deeper topic, but my old patients that need change of a plan because the season changed. Now it is springtime in Croatia, so they want something fresh with vegetables that are now available for them.
Of course, and then you're on it. Yeah, that's true.
Yeah.
Nice, lovely. Enjoy your day, right? You have the whole day ahead of you.
Yes.
I'm sure we're gonna stay in touch because actually I would like to be your client right now as a human being if it's doable. But you're so far away, so you can't stick a needle in me. But that's okay. Hopefully we can help our patients, with diet and with drugs if we have to. And then later on we will slowly reduce it and we'll try to reach to the core actually of their condition and their disease, because I know there is a lot in England and Poland. It's so much that actually I was shocked and a bit scared that is going that way. Cancer, allergies, autoimmunological disease, they are overtaking the veterinary medicine right now. Not like broken bones or accidents, no, metabolic diseases, obesity, right, or diabetes. So hopefully we'll be able to change it with the right approach. Okay. Bye. Nice to
Thank
see
you
you.
so much. Bye.
Bye.